This is the third noon workshop that the Center for Dispute Resolution is sponsoring this semester. We really appreciate the commitment to attend these workshops. Let's do, while we're waiting for others, a couple of housekeeping things. Be sure to put your name in the chat for Master Advisor credit. And also, as always, we have the book giveaways. So today's book, it's actually been on the bestseller list for a while. What Happened to You? It's by Oprah Winfrey and Dr. Bruce Perry. So Heather's holding up the book. And she's going to do her magic of pulling your name out of the hat, or hopefully your name. Heather,
yes, so all right. So our two winners today are Faith Andrews and Bennett. Congratulations. And
excellent.
Private message so we can send you your book.
Perfect. Okay. One of the things that I've noticed is that there is a lot of discussion about trauma everywhere you look, and rarely do we connect trauma with conflict. And so we're really fortunate today to have Teri Hargrave talk to us about the links between trauma and conflict. Teri is the program coordinator for the Office of Dispute Resolution and Family Court Programs in the 7th Judicial Circuit. But she's also an alum of Missouri State. She got her bachelor's degree in criminology. She received the graduate certificate in conflict and dispute resolution. And then she's gone on to get a master's degree from Creighton University in negotiation and conflict resolution, and is currently working on her doctorate at Abilene Christian in organizational leadership with an emphasis in conflict management. So we're thrilled to have Teri here. And with that, I will let her go ahead and get started.
Well, thank you, Shar and Heather, of course, for having me today, and CDR. Thank you all for taking time out of your day to be here, and I'm super excited. As Shar mentioned, we will be discussing trauma, coping with trauma, how trauma has affected the body, trauma triggers, and helping those who have experienced trauma feel safe. So especially now, more than ever, more individuals are being exposed to or have experienced tragedy in their life leading to trauma. So when I say trauma, and I'm thinking psychological trauma, what definitions pop into your head? Just throw them out there. What comes to your mind when I say psychological trauma? Anybody have any ideas?
Painful and challenging.
Okay, yes. Anybody else have any ideas what comes to mind? Someone in the chat says rape. Yes. What could be other traumas or definitions of trauma?
I think of abuse of any kind.
Abuse. Yeah.
There are some other chat comments. PTSD, major distress and dysfunction to life or a life impacting event, loss.
Yeah, everything. All of that are definitions of trauma. So really what the underlying thing is the loss of trust in a perceived safe and predictable world. And trauma looks different and is different for everybody. Trauma is what we internalize as being traumatic. And these traumatic experiences can range from physical abuse to parents divorcing to natural disasters. The severity of the event may differ for the individual as well, depending on if they saw the event or the aftermath, families' reactions, previous experiences with trauma, and family or community support. Trauma triggers can continue to affect an individual well into adulthood or even for their entire life, which is why childhood exposure to trauma is gaining recognition as a public health crisis. So there are many different types of trauma. Shock trauma occurs when something happens, it happens too fast, too soon. We can't really cope with it. We didn't see it coming. Developmental trauma is an ongoing, maybe some sort of family dysfunction growing up. Systematic and institutionalized trauma can also occur when an individual fails to protect students who have experienced trauma. Now, these events may be one time, multiple times, reoccurring, or short term. They can also witness it, not only by seeing the trauma and the event actually happen, parents fighting, domestic violence, also seeing the aftermath of it, which is something that I didn't really think about, but seeing the aftermath of that event can also have an impact. And also listening, hearing gunshots, hearing parents fight, hearing glass being thrown. So all of those have an impact on the individual and how they internalize trauma. I'm not going to bore you all with a lot of brain development talk, but I do think it's important to know that the brain continues to develop well into young adulthood, and that trauma can affect brain development by changing its overall structure, organ systems, and stress management. Trauma and constant stress can impact the development of executive functions, including empathy, emotion regulation, problem solving, decision-making skills, memory, and impulse control. Our neural connections continue to develop well into college. So just like any activity, the more you practice it, the better you get. You don't practice, maybe you kind of lose some of that. That's how your neural connections are as well. The more you use them, the stronger they get. The less you use some, the weaker those get. So when someone has experienced trauma, their fight, flight, freeze response is activated. Fight, you do anything you can to deter that threat. Flight triggers adrenaline, increases heart rate, blood flow, motor skills. Freeze, your body levels slow down. That means your inability to move. So just as a visual thing, your brain, your hand can be formed into a brain model. So obviously it's not accurate, but for this, it's a good example. So if you were to hold up 4 fingers, your thumb is your amygdala. That is your fear center. That is your fight, flight, freeze response. Your fingers go over your thumb. That is your prefrontal cortex or your thinking brain. So that's where all your logic, reasoning, language, control, that's where all that comes from. So if someone were to just close the door right now, you know, I may jump a little bit, but I know it's going through my thinking brain, hey, someone close that door. However, if I'm in a traumatic state or if I'm in a wake of trauma, someone closes that door, it would look very different, right? So in the wake of trauma, your prefrontal cortex, that thinking brain, is flipped up. So right now, your amygdala, that emotion, all of that is in control. And they don't have the same reasoning skills as your thinking brain. So you've kind of, they call it flipping your lid. Okay, so those fingers come up, that prefrontal cortex is up, you have flipped your lid. The hypothalamus releases stress hormones or cortisol. The more stress hormones we have, the more alert we are to danger. So what we have to do is put those fingers back down and wait for that to come back down, for that logic and reasoning. Another good visual is like a snow globe, okay? We all like snow globes. We all like to shake them up, see the stuff go everywhere. That's kind of what your brain is doing in the middle of trauma, right? It's kind of hectic. Nobody knows what's going on. You can't see through it. You maybe might not reacting like you normally would. So we have to wait for all those little particles to fall back down. That's what putting your lid back down needs as well. It just needs a little bit of time for that logic and that reasoning to come back. If someone is in a fear-activated hypervigilant state, your body goes into self-protect mode. Your brain is doing anything it can to help you feel safe. And just like trauma is individualized, this is individualized as well. So your body's response may be disrespectful, being defiant, overly aggressive. It could be maybe going into more a disassociative state or zoning out, drifting off. It's whatever your body needs to feel safe and to remind your body that you are safe. So that snow globe, you've got to wait for it to come back down. Just the same thing, you've got to wait for those fingers to come back down or close your lid. Okay, again, not an accurate brain model, but it helps flipping your lid, right? Any questions over that brain stuff? Okay, so when I say trauma, what am I really talking about? The adverse childhood experiences, or ACEs, was first introduced in 1998 by Dr. Folletti. However, the last 3 years, it has grown increasingly popular. The ACEs study and the survey is very well known. However, it only covers 10 traumatic events. Now, these are not the only 10 traumatic events that someone can suffer from, but this is the most widely used. So the ACEs survey and the ACEs study focuses on emotional abuse, physical abuse, sexual abuse, emotional and physical neglect, also family dysfunction, incarceration of a relative, domestic violence, mental illness, and parental divorce and substance abuse. What could be some other traumatic events that could happen? Oh, and thank you, Heather, for putting the ACEs quiz in there. Yes. What could be some other traumatic experiences? So while you all are, what was it?
Car accident?
Car accident. Yes, absolutely. That can be traumatic.
I think COVID.
COVID. Yes. Witnessing a death. Absolutely. Job loss. Yep. Loss of safety, right? So maybe home being broken into, car being broken into. Yes. So all of those, there's many different things. Natural disasters. Yes, natural disasters. Someone just typed it in. Yep. So these focus on only 10 of those. However, it is widely used, and the ACEs scores have been associated with later in life outcomes, including health, unemployment, risky behavior, school-related issues, delinquency, and recidivism. 85% of individuals who attend college have reported at least one traumatic event. They have been exposed to at least one traumatic event, although most have reported that they have been exposed to multiple traumatic events. 50% of freshmen report experiencing a traumatic event during their freshman year, right? So what exactly does this do to the body? We've talked about what trauma is. We've talked about the impact on the brain, but how does it affect you? Mental health, coping skills, memory, anxiety, stress, depression, physical health, which is heart rate, muscle tension, heart functioning, sleep, weight control, relationships, job satisfaction or school satisfaction, job and school performance. Those who have experienced trauma also experience some post-traumatic stress symptoms. And what that is when an individual has experienced multiple traumatic events and has internalized it as traumatic and experienced those psychiatric symptoms. There have been many research studies that correlate ACEs or traumatic events to PTSD symptoms. The DSM-5, which is a handbook clinicians use to diagnose and help individuals with mental illness, It was very difficult to be diagnosed with post-traumatic stress disorder if you had experienced multiple traumas, maybe not necessarily in the military or anything like that. It was very hard to get diagnosed with that prior to this new DSM-5. But they did add self-destructive or risky behavior to that DSM-5 because many people who have experienced multiple traumas also are more likely to participate in risky behavior, meaning drug and alcohol misuse, self-harm, criminal activity. However, if someone participates in that risky behavior, it doesn't necessarily indicate that they have had trauma previously. But those who do have trauma are more likely than those who have not to participate in those activities. So what that risky behavior does is give that individual control over a portion of their life because they do not have control over past trauma or maybe current circumstances leading to additional trauma. However, what they do have is control over that event. They may lack the coping skills to deal with that trauma and the post-traumatic stress, those psychiatric symptoms, that leads them to engaging in that risky behavior because it gives them a sense of control. So I know we've talked about a lot, and it's kind of been, we've talked about ACEs, we've talked about brain development, post-traumatic stress. Any questions so far? Okay, if you ever do, just go ahead and put them in the chat or raise your hand. I don't know how many times, even in the grocery store, walking down the street, someone does something and then you hear, what is wrong with you? Right? But that's also casting some negativity, like that person's doing something they shouldn't be. So what if we change that question to what happened to you and how can we help? That changes that negativity and opens up that conversation that, hey, I'm here to help. What can I do to help you heal? Right? So just a simple change of that question has a major impact. Now, if we were to talk about traumatic memories, they can be triggered anywhere, right? So they're primarily sensory triggers, smelling something, tasting something, hearing something, maybe a texture of something. However, those memories can be fragmented. Okay, so if you think of Swiss cheese, there's some holes in there, but it all fits together. That's kind of traumatic memories. The parts that maybe are too distressing or too traumatic, they want to forget. So your brain kind of just shuts that portion out. So you remember pieces. The hippocampus also may stitch together memories to make that event even more fearful. And when an individual tells a story, it is told from the perspective and the age of when it happened. So when I say May 4th, 2003, to some of you, that may mean nothing at all. To some of you, that's another event in your life, something that has happened. Or if you're a Star Wars fan, May the 4th be with you, right? However, for me, May 4th, 2003 is when my house was destroyed by a tornado. Okay, so up here in Kansas City, May 4th, 2003, we had a tornado, completely destroyed my whole neighborhood, took my house. I was home, we were all there. And I was actually telling this story to a judge on Monday. Hadn't planned on it. We were just talking about something. There was no bad weather. Of course, I'm not the same age I was then. I have a lot more education and my vocabulary is far greater than it was. However, while I was telling this story, I can't come up with words. I tell it as if I was the age I was in 2003. I start shaking. I can tell my body starts tightening. My heart's racing. I get hot. And I'm safe. There was no bad weather going on outside. I was in a courtroom. I know that might be traumatic for some of you, but it's my daily life here. So I'm safe, right? However, my body is not responding that I'm safe, because at that moment, I'm back in 2003. I am not in the present. So what I have to do is bring myself back to the present and remind myself that I am safe. And I know not too long ago, Joplin, I think it was right before I came down there, had a tornado there too. So a lot of students may have this thing, and if I'm telling you this story right now, you're probably going back there. So if you need to take a minute, go ahead and do that if you need that. But that could be something going on. And I don't know if you guys have this in Springfield, but up here on the first Wednesday of the month at 11 o'clock, they test the sirens, the tornado sirens. And no matter where I'm at, I hear that siren, I immediately look at my watch and I go, first Wednesday of the month at 11 o'clock. Because I just have to bring myself down and be like, that's not what's going on. It's the first Wednesday. Now, while I remember a lot about what happened that day, there are some things I don't remember. I don't remember how I got out of the house. I know I kind of walked up the stairs, and I remember seeing a tree in my living room and a refrigerator that was not ours in the kitchen sink. Weirdly enough, my mom's purse was still on the kitchen table while the rest of the house was destroyed. We stayed in a hotel. I don't remember the hotel. I don't remember that night. I remember they all brought us, all the kids and the parents made a pact to go to the same apartment complex. So we all lived in the same apartment complex. Can't tell you anything about that either, right? So although I remember it, it's like Swiss cheese. That primary sensory, I can hear that tornado siren, the wind, anything like that, even talking about it, I get anxious. But I don't tell it from how old I am now and my education and my vocabulary being greater. I tell it from the 4th grade me. So that's what those look like when someone is traumatized, right? You might be like, well, why can't you remember? Because their brain's not letting them. It's going into safety mode. And some of that re-experiencing can come from dreams, thought, flashbacks, behavior. And while someone looks fine, they may be in a hypervigilant or aroused state inside. It may involve sleep problems, an exaggerated startle response, hypervigilance, or an elevated pulse. If you see someone looking around the room, they might be having a hard time at that moment, and they're just trying to make sure that things around them are safe, right? So if someone's looking around and something's happened to them, they're traumatized, they just may be looking around like, okay, is there anything in here that can hurt me? Does anybody have any questions over any of that? I know it was a lot. Okay. So how do we cope with that trauma? Sometimes it's denial. That did not happen. Nope. Or maybe it's forgetting. No, I don't remember that. Avoiding the reminders. Unfortunately, I'm in Missouri. I can't avoid the weather, right? But individuals may avoid other reminders. Avoid formally enjoyed activities. Again, it's that control over their life. I don't have to do that. I know I liked it, but I have control over not doing it. Losing acquired skills. This mostly relates to younger kiddos, may go back to bedwetting or something like that. And again, those risky behaviors. Sometimes emotions become dysregulated and they tend to think, why did this happen to me? Why me? They begin to self-blame or doubt themselves. They don't think, they never saw this coming, right? And so although they had plans for the future, now everything's changed. And so they have a shortened sense of what's next. So I know I'm a planner. the first thing I did when I took this job was get us a Gmail calendar, right? So I walked in, I said, hey, is there a calendar we can do? And she said, no. And I said, okay, can I make one? Right? The last thing I do before I go to bed is check my calendar. What am I going to do? When I was changing from one job to this one, that routine, that, hey, I know what I'm doing tomorrow. I know what I'm doing next week. I know what I'll probably be doing in a year, right? That was gone. People are like, hey, what are you doing? And I'm like, I have no clue. I'm just starting a whole new thing in my life. That's kind of the same that they're doing in this transition in college, right? That routine is gone. Those reminders, those, maybe they're not sure what their schedule is going to look like. They're forming new friendships. It's a very difficult time. So that future may be a little bit shortened because they're like, I don't know when I'm coming home next. I don't know when I'm going to have time to call or talk, right? So how can we help with that is through a routine, getting them in a routine, looking at their schedule, giving them as much information prior as you can. They may feel that people look at them differently. Like, even if you don't know, like you all didn't know that I had been through a tornado, right? So you all didn't look at me differently. However, I felt different, right? And now that I'm sharing, part of me is like, they may be looking at you different, right? That's what people feel also. When a traumatic event happens to them, they think other people view them differently, even if they don't. Even if they may not even know about what happened, they feel different and they think others view them differently. Also, a limited range of feelings. Okay, it's kind of going back to that shock. They don't know how to react. They're just kind of in shock. So they're like, yeah, it's okay. That's fine. But they're not really experiencing extreme happiness or extreme sadness. They're just kind of numb, right? So that's how people cope with that trauma. And that's what you could kind of see out of people, maybe helps relate a little bit more, gives them that sense of control as well. So how do we help individuals who have been working with or who have trauma histories? Trauma histories can be triggered by anything, as we just talked about, but change, uncertainty, feeling out of control, basically abandonment and rejection. All they're looking for is to feel safe. That is what everything is grounded in. So whatever you can do to help that individual feel safe. Maybe giving them choices. So can we watch a video at home? Maybe telling people, hey, this might be triggering. Here's options if you want to watch this PowerPoint, this coursework, this video outside of class. If you do decide to come in, if you need to step out, please feel free to take that moment, okay? Maybe giving them as much option as you can because that gives them that sense of control back. Resilience. There's a very common saying that kids are resilient or that they bounce back. However, the more trauma that happens, the harder it is to bounce back, right? So if we focus on strengths, focus on this individual's strengths, whatever their strengths may be. Maybe they are an awesome writer, or maybe they have great conflict skills. Maybe they are great at staying calm in settings that may not be calm. Focus on what their strengths are. Maybe go outside of that. Be like, you know what? You always brighten up a room. Give them that empowerment as well. Focus on those goals is how we increase that resilience. And increasing that resilience is internal and external assets, which we will talk about in the next 2 slides exactly what those are. And helping out with some trauma-specific mental health treatments. However, not all clinicians are trained to do trauma work, so be really careful. Make sure that you are contacting someone or helping others contact an individual who is trained in that trauma work. And individual trauma-informed practices, they have been around for a while. They've been around since the 2000s to bring awareness to the effects of trauma and help clinicians diagnose and treat PTSD, other trauma-related symptoms. However, these practices vary based on the needs of the individual. Just as we internalize trauma different, what we need to get help to have some post-traumatic growth differs as well. So approach that may work for one, may not work for another. But a major factor in that growth is acknowledging the trauma happened and its impact on the individual. And once that growth starts happening, some of those health outcomes get better, have positive movement. There's academic success that happens. So some of those negatives that were impacted by trauma can be positively increased with resilience. So when I say external assets, what exactly am I talking about? You're probably like, Teri, I have no clue, okay? So external assets are support, family support, other adult support, mentors, RAs, teachers, advisors, empowerment. Again, goes back to that safety. Maybe they want to get involved on campus. Maybe they want to get involved in community organizations. I know Missouri State has a ton of programs and fraternity, sorority, honor fraternity, NSCS. There's a ton of stuff down there. And not only that, but community programming as well. And then forming those boundaries, okay? Positive peer influence, getting that routine, and then constructive use of time. So it's again going back to that routine and time management. With the help of therapy and external assets, an individual can increase their internal assets. So before I get to that, are there any questions on external assets? Yeah, the 40 developmental assets are very well known and are absolutely used in schools here and in other areas. So anyone questions on the external assets? Internal assets. These are a little bit more difficult to grow. However, through the help of those external assets, they can be done. And it really comes down to commitment to learning, getting back to those goals. What is the goal of school? What is my homework goal? Student engagement, positive values, having responsibility, honesty, integrity, social competencies, working on those social cues. Someone who has experienced trauma may have a more difficult time opening up to people and recognizing those social cues. Okay, so they might need to work on that, but working on that will definitely help with those friendships and role models. And then self-identity, building up their sense of purpose, their self-esteem, anything like that can also help with that post-traumatic growth and building those internal assets. Any questions over 40 developmental assets? So how to help someone when you see they are triggered? Remain calm, even voice and manner, even though inside you may be freaking out, it's okay. But if you can just remain calm on the outside, provide as much space as possible, especially physical space. I know when I see somebody crying or anything like that, I want to go over and give them a hug or put my hand on them, and they probably might sucker punch me if they're triggered, right? Because they don't have any control. Again, that emotion brain is coming into play. They're back in that past. So we have to bring them back to the present. So maybe putting our hand on them, even if it is to bring them back in the present, we just need to let them know like, hey, Why don't I take you to a safe place? Where do you feel safe? What do you need from me? What can I do to help you feel safe? And some of that people may use, I know fidget spinners came out a long time ago, right? We've all probably seen them or see somebody who has a squishy ball or hair tie, pin, doing something, doodling. And I know I always say, well, I used to say with my niece and nephew, I'm like, hey, put that down so I know you're listening. But in fact, they really are listening. They're trying to get those emotions out, right? So another skill that I use here at the juvenile office, everyone has baskets of fidget spinners and things to keep the hands busy of the kiddos they're with, because this is a very trying environment here. And in the courthouse, if someone is visibly upset or you can see they're triggered, I say, you know what, why don't we go somewhere quiet? And if you'll do me a favor, why don't you just close your fists, close your eyes, and just say over and over, I am safe. I am safe. Because it is reminding them, bringing them back to the present and reminding them like, hey, I'm safe. I'm safe. Calm down. I'm safe, right? So that's just a technique. Those fidget spinners, those things to keep your hands busy, those really do serve a purpose. And it's helping that person get through whatever they're dealing with, but also saying, you know what, why don't we go somewhere? Why don't we sit down and see what we can do to help you? Yoga, mindfulness, maybe music, anything like that, whatever they need to calm down. Again, going back to choice, give them many options, especially if there's something that could be triggering in a conversation. When someone may be acting out or defiant, anything like that, here in the juvenile office, we have a new program for truancy. And what that is we talk to them, we have community resources, and we get to the underlying cause of that truancy. And because that truancy is just a symptom of what's going on. And it's the same thing. A person's actions, they really may not mean to be doing that. It's underlying. What is the root cause of this? What is this root cause of acting out? What are you feeling, right? That's what we need to get to. We don't need to deal with the, okay, well, we need to get you back in school. Okay, but what else can we do to help? I know that maybe someone's being defiant, acting out, maybe having arguments, anything like that. What is the underlying cause to that? And again, never touch someone who is actively triggered. As much as we may want to give them a hug, maybe wait for them to calm down and then ask, is it okay if I give you a hug? Or is it okay, maybe we just do a fist bump, okay? Any questions on helping those who have been triggered or helping individuals feel safe? So again, all of this comes down to safety, helping someone feel safe emotionally, physically, trustworthiness. These are just principles of a trauma-informed approach, choice, collaboration, empowerment. It's things that we've kind of been talking about this whole time, right? College is a major adjustment for anybody at all, but also for those who have experienced trauma. Making new friends may be difficult, that routine that they still need to figure out, being vulnerable, sharing a living space, maybe they've, and especially with people you don't know. Finding new role models, new academic expectations, juggling school and work or school and family. So there's a lot of stuff going on in college, right? So what we need to do is just provide as many resources as possible, help those individuals, remind them of safety, get to that routine. The transitional time in someone with a past history can lead to being re-traumatized in college. As we spoke, and those statistics earlier showed, a lot of people have experienced trauma or either experience it prior to or during their freshman year, right? So what can we do on campus or in a group or anything like that to help and to maybe lower the rate of being re-traumatized? Right now, you guys are doing it, realizing that there is trauma out there, but there are also paths to recovery. Those trauma-informed practices, being aware, recognizing the signs and symptoms. So making sure we get those out there. Maybe if someone's acting out, hey, you know what, let's just take a second. Maybe not saying, I understand you're triggered, but saying, you know, this might be a lot right now. So why don't we take a second, step out, and we'll come back. Putting trauma information into policies, practices, procedures. Organizations tend to implement these practices and procedures that align with their goals and values. So look at what your goals and values are. Maybe collaborate. I know NAMI is very big on campus, or used to be, the National Alliance for Mental Illness. Getting with them or other community leaders to look at policies and practices and procedures of what is going on campus. And then resisting re-traumatization, which means maybe having tons of resources out where anybody can grab them. In the PSU, in the health center, in all of the dorms. Harvard has specialized areas in dorms and in classroom buildings that are there for people to de-stress and relax. Positive feedback, really looking at school trust, connection, belonging. I know there's a ton of different programming at Missouri State and in the community. And so maybe just getting out there like, hey, this is everything we've got going on, helping people get involved, spreading the word. Positive feedback and role modeling. Increasing positive relationships with students and with staff can really be big. Again, giving options. It just goes back to creating a safe and positive learning environment. Creating programs to help mindfulness, yoga, academic resilience, maybe coping skills, positive coping skills. And then continual training on trauma and the signs and resilience. Resources, 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 okay? And make them available throughout campus, put them online, right? So although these discussions and these programming and whatever is integrated after this, talking about trauma can be very triggering, but it's also very impactful. So that's what helps with that post-traumatic growth as well. Where to look for trauma-informed therapy? These are two really great websites that you can look at specialties that are needed in your area and see who exactly is trained in trauma work. Again, these are three other resources. We've kind of talked about the What Happened to You book. So congratulations to the winner of that. But it's a very great book on trauma and resilience and healing. And Dr. Bruce Perry talks about patients he's worked with and how this has impacted them and how he's helped. Dr. Nadine Burke-Harris is actually a pediatrician in California. And she is one of the first to actually put together trauma ACEs with maybe ADHD, ADD symptoms. And then The Body Keeps Score is a very good book as well. It can be a little bit more triggering for people, but it really does go into how your body has being impacted from that trauma. If you are looking at resources or how to get more trauma-informed programming on campus, handbooks, policies, procedures, the Missouri Department of Mental Health has a really good outline about trauma-informed practices and policies. The other 3 of these websites has free handouts and free resources. So they are really great to just have out there, maybe put on the website to help individuals, and not only those on campus, but also community members who may need the additional support as well. So I want to thank you all for being here and for doing that. Hopefully I didn't talk too fast. I tried to remind myself to slow down. But does anyone have any questions? I'd love to see what y'all got.
Teri, we often see students come in. We do coaching and work with students who have experienced or who've been involved with student conduct issues. And a number of the things that you talk about are things that we see with those students. Although I see these behaviors with adults who are in conflict as well. Obviously, we're not therapists, so we work on the coaching piece and specific behavioral piece. But what would you suggest in terms of, how to handle those things? Or, because you're not going to say to somebody who's in the midst of a conflict or who comes in for mediation, perhaps there are trauma issues that you need to be exploring. I mean, how would you handle that?
So it depends also on kind of what the problem is. So somebody who may be aggressive or more physical, maybe being, okay, well, why don't we do some jumping jacks, or why don't we get something out, get that aggression out, give them something to do with their hands. Maybe say, let's focus on goals and topic. What is our goal here? Let's not look at the past. Our conversation today is to talk about this one incident. What can we do to either prevent this from happening again, or making you feel safe? What we also do is in our truancy cases, we've had a lot of anxiety. And so if you feel anxious, what can we do? If you feel this way, what are some things that we can put in place if you start feeling that way that will help you? And it goes back to, what do you need from me? So in the mediation or in a conversation with somebody, if you feel them getting a little too anxious or a little too upset, their tone starts to change, their body language changes, maybe it's time to take a walk or a 5-minute break. Let them cool down, let that lid close again, and then bring them back into the present and say, okay, what can we do now for this? Or, hey, if someone is egging you on or starts to get you upset, let's plan on a way to reverse that. What can we do? Does that kind of answer that?
It does. That
Okay.
does.
Sometimes I ramble, so I'm like,
Oh,
hopefully
no, that was very helpful. Thanks.
Yes. Specific resources for college who come out of foster care. Yes, there are some foster care resources out there. That the first website, the National Child Traumatic Stress Network, has a ton of resources out there. And then there are some websites for foster care and how to help individuals who have been in foster care. But the National Child Traumatic Stress Network is a great website. Any other questions?
So I have a question for you. I actually work for the Division of Youth Services in the state of Missouri. So when you said you were a juvenile officer, I was like, oh yeah, we work together. What do you think would be some ideas as far as to help? I know one of my coworkers is dealing with a family, and the family has had a lot of traumatic things as far as they lost their child at 3 due to cancer, and the family's not done any type of trauma recovery for that at all. And now the mom is losing her mom. Her mom's not doing well. And so obviously we work very hard with the youth and trying to kind of help them do a lot of stuff, but how would you handle as far as like maybe with that family? Because obviously we can't force a family to do something.
Right. Yeah. The first step to all of this is that acknowledgement, like, hey, this happened. And if they can't do that just yet, and we don't want to push them, because that can just lead to being further re-traumatized. However, maybe getting the family together with not calling it family therapy, but maybe, I mean, we have family group conferencing, and I know Shar and Heather also provide that. Getting that together with a person who is maybe has a background in psychology, helping them form an action plan on how we're going to move forward, what that looks like, what the goals of the family are, and then how we're going to achieve it. So looking a little further down, because right now they're probably just looking at day to day, but making an action plan for what comes next. But it's very difficult, no matter how much training or anything, if they don't want to even go back to it or acknowledge it, that denial as a coping mechanism, they may just need time. That's a big one. Question. How can students explain to professors that previous trauma might impact their mental health and by extension their schoolwork? That goes back to role models and building that positive relationship with a professor, or the professor building that relationship to the student. If you feel comfortable to open up and say, hey, this is what's going on. I'm having this, I'm experiencing this, or something's going on in my family. It goes back to that training and those signs, and hopefully they would understand that enough to give you that extension. But also understanding that if you don't want to open up, that might also impact that as well. But it's about forming that good relationship. If you have a good relationship with that professor, that would go a long way. Or the professor has a good relationship with their class and their student is open, recognizes and has been trained in trauma and the signs and what it can do, is also major. So looking at policies, practices, maybe even putting information in the syllabus would also be important. It just comes down to how open the student feels to open up and building that relationship. But I do think trying and attempting to let the professor know if you are feeling that way, even if you don't want to go in depth, like, hey, we had a natural disaster, I'm going to need more time. Or, hey, this is what's going on, I'm going to need more time. Just communication. Communication goes a long way. Any other questions? I want to be cognizant of everyone's time. That's why I'm just like looking.
We're at about 12:55. Any other questions before we end? Thank you so much, Teri. I think this was really informative and certainly helped me think through some things that I'd wondered about. Thanks.
Oh, thank you all. Thank you for having me, and thanks for everybody attending today.
We will see all of you hopefully at our next session after the holidays. So have a great rest of the semester.